There is concern in the public health community that patients or people being on PrEP will lead to higher rates of sexually transmitted infections on people who are on PrEP. There's definitely a trend that's well documented, and as a provider, I see it all the time, where patients come in, maybe they haven't had an STI in years, and all of a sudden they've had 3 in 1 year after starting PrEP. And I say, what's going on? And they say, well, I can't get HIV, so I'm not using condoms. So it's very concerning. There is data that we have seen drug-resistant gonorrhea, especially in Europe and Asia. We've seen a few cases here in New York, but we're concerned that people are maybe taking more risks with their sexual health because they're on PrEP and they feel immune to HIV. And then also these infections are not getting, perhaps people aren't waiting 7 days after they get treated, the appropriate amount of time after they get treated in order to start having sex again. So we're concerned for the different bacteria mutating to become resistant to the medications we currently have. That's why I really emphasize with my patients, PrEP works best if you're healthy. You stay healthy by using condoms. If you have a syphilis chancre, which is an ulcer somewhere in your body, that's a big opening in your skin, which is your protective barrier against HIV. That puts you at a really much higher risk to get the virus. We are concerned for drug-resistant STDs in the long term, but I'm also concerned about keeping my patients HIV negative right now. So it's part of it is an education issue where, I and the colleagues that I work with are making sure we're telling our patients, please use condoms, please use condoms. I don't know that every provider is doing that. Part of it is also just people are tired of being afraid of sex. I think for many, many years in the gay community, people were afraid because of the HIV epidemic, and now people feel like they've been given back that sexual freedom that they maybe experienced in the 70s and 80s. And so it's very tricky, but I just try to make sure my patients know that it's important to use both Truvada and condoms.